think?
Yeah, I think it's a good time.
All right. Well, I'm pleased to present Amber Sophus, who is a Reeds Fellow here at Yale, but works at Florida International University and is right now in Houston, Texas, where she's probably a heck of a lot warmer than we are up here. You know, there's others who are in the sunnier climes. So I want to turn this over. She can give herself, give a brief introduction about who she is and set the groundwork for today's presentation. Take it away, Amber.
Thank you. So hi, everybody. Thanks for showing up, coming in, being interested in nominal group technique. Again, my name is Dr. Amber Sophus. You can just call me Amber. I'm a social and behavioral research scientist, about 10 plus years of research experience. My research is very community focused, very community driven. I'm currently a postdoc at FIU. Again, I'm a Rees Fellow. I'm also engaged in other community-focused things. I'm on the board of directors for a nonprofit. I help out creating health promotion materials. I'm an advocate for dismantling stigma when it comes to STI. So many hats, but to my core, I'm a qualitative researcher. That was my introduction into research. But as we all know, like the quantitatives always want us to like include quantitative research in our stuff. And we always have to fight for making sure that qualitative research has a voice and there's strength in it. And then quantitative doesn't tell you the why or the how, which is really the meat of research. So today I'm going to really talk about nominal group technique. Dr. Lynn Madden talked about this, I believe, a month or two ago in her presentation, and it was great. And it was using nominal technique in person. So I'm going to talk about how we can adapt this and use it in a virtual space. Given COVID, a lot of things we did have to change. We really had to use Zoom and Microsoft Teams and really learn how to adapt our research methods to that virtual environment. So I'm going to talk about that a bit throughout this presentation. And feel free to ask me questions as the slides go on. You don't have to wait till the end. I want this to be collaborative. I do have discussion questions in here, so you will have to participate. So let's go ahead and get started and get things moving. Give me a minute to set everything up for you. All right, can everyone see my screen pretty well? Great. So I'm going to be talking about just leveraging nominal group technique in online focus groups because that's how I used it. But I really want you to start by thinking about how can I use this particular technique within my public health research, and what are my questions with regards to how I want to use this technique? What would be my research inquiry around using it? So I'm going to be talking about, give you a little brief overview about what NGT is, background about it, adapting NGT in a virtual space. I'm going to provide some examples, and then I'll also give you about 4 to 5 specific resources that may be good for you to use. So feel free to take a screenshot for those. So if you weren't here when Dr. Madden did her presentation, she really gave a super great, thorough explanation about what nominal group technique is. To its core, it's a structured consensus method. You're able to generate and rank responses in real time. So basically, that data collection part is really driven by 3 main things: problem solving, idea conception, and prioritization. Technically, it is a mixed method approach. You are, again, able to generate those and generate immediate data in real time. So you're having the quantitative data, you have a rank, you get that real-time quantitative data, but then you're also using your focus group to acquire that qualitative data, the how and the why, based off those rankings. And we'll get to that in a minute. Traditionally, NGT is done face-to-face. The time required can vary. It could be 30 minutes, depending on your specific question and how you opt to utilize the NGT processes, or it can take up to 2 hours. It really just depends on your specific questions during the discussion phase. And then the number of sessions, I love NGT because you really only need one with those particular participants. You don't have to keep doing multiple rounds of NGT sessions with the same group. And that's something that's really nice. So you save time, you save money. There's really a lot of perks to using it. So kind of know about what NGT is as far as the definition is concerned. what does the process really typically look like? So there's technically 4 key steps. You have this presentation of your nominal group question, your nominal question, and then you have this silent generation of ideas where you're asking everyone to take time to just create, or like list items or tell their ideas about your specific research question in writing. And then you have next is round robin sharing, where each person that's present provides their list of ideas, and they may even provide definitions, they may provide their point of view, but you want them to keep it fairly to the point and simple. Next, you have this clarification and this grouping. So you want everyone to tell what their ideas mean. Maybe there's similar ideas, so you're going to group them together. And then you want the entire group to agree on what that list is. And then the next step is having that voting and that ranking part. So you're going to have them individually rank those ideas that they just came up with, one being the most important, or 10 being the least important, depending on your number of items, as well as how you want them to rank these items. And again, you'll usually do it by the number of items you have. If you have 5 items, you want them to rank 1 to 5. If you have 10, 1 to 10. But there's different ways to do that. You can also have everyone only get 2 votes for 10 items. And you want them to provide their top 2 items that are most important. So there's different ways you can have them ranked. I think the easiest way is just to do it 1 through 5 or 1 through 10, and you'll see why you probably would want to do that in a more virtual space. So basically, responses are weighted by the participants, and the process is very transparent. It's inclusive because you have this discussion, this round robin part, and it can be easily replicated. But each of these key activities occur in sequence. So with each output of each step informs the next. So the silent generation informs the round robin, which informs the clarification and grouping, which informs the voting and ranking, and also the discussion of those voting and ranking towards the end of that process. And so NGT is very flexible. It allows researchers to really just adjust the delivery of these key steps according to maybe the characteristics of your participants or the research question that's really driving the research inquiry for your particular study. So what are some ways we can do that? You don't have to have 4 steps. Let's say maybe you want 9 steps. So for instance, Gorman and colleagues identified the needs of critical and acute cardiac care nurses within the first 2 years of practice, and they did that using nominal group technique in 9 particular steps. So you can see step 1 is where they gave them worksheets, and they introduced their particular nominal question, which was, what do you think your needs are working in an acute cardiac hospital? Very simple, very qualitative in a way, because you want them to list those things and as many as possible. So you provide a timetable. And then you have them do their silent, independent generation of their ideas. Then you have, again, that round robin, as you can see in step 3, where they one by one provide those ideas that they created. And then you have, again, step 4, that clarification of ideas. They're providing a definition for what they mean. Maybe you're grouping similar ideas because the group feels like pink and light pink are the same color. And so then after that, you go to this step 5, where you've then consolidated all of the items into a list, and you've asked them to then individually select your top 10 most important items. So in this study, they did that. And then you see in step 6 and 7, 6 is they have the ranking. And the interesting thing that they did was in their step 7, because it was in person, they gave everyone a break to give them time to then consolidate and tally those rankings to provide an overall group rank. So everyone can see what the overall group said was number 1, 2, 3, and so forth. And then you have 8, where again, you have that discussion of those results, meaning that discussion of the top 10 rankings, the order, why they ranked them that way. And then at the end, they were given like the opportunity to re-rank their those items based off of the discussion. So that's just one way that you're able to kind of manipulate those initial 4 steps for nominal group technique. Another way is to do it in 7 steps, and where you have an introduction of the topic, where you talk about the purpose of the study and the explanation of what they're going to be doing, and maybe even explain what the NGT process will look like for them. And then you have, again, that silent generation of ideas, the sharing of ideas through a round robin format. And then you have a group discussion where you clarify what those items are. And then you have silent voting, again, where they rate those options or items or ideas that they came up with. You discuss those folks. Why did they choose to rank them in that way? And then for this particular one, they just had a conclusion. They didn't do a re-ranking of ideas. They didn't give them, they didn't need a break to tally those numbers for the entire group to provide an overall group ranking of how those options or ideas were chosen. So this is just another way that you can manipulate those steps to better fit your particular study. So overall, we can think of it really in 6 steps for nominal group technique. The silent idea generation, the round robin sharing of those ideas, clarifying those ideas by having a group discussion where you will consolidate those options if needed, maybe provide a better definition or wording for certain things, and then you go on and have that private ranking or rating of those ideas, items, and so forth. Then you have that group discussion of why they rank those items, and then if you want, you can have them re-rank those items or ideas based off the discussion that they had. So technically, there's 2 main things that are important for nominal group technique. The problem is presented to the group as a nominal question, thus generating this discussion around ideas and individual participants. And then you have this voting or ranking phase where participants prioritize those ideas that were generated. So these are technically the steps for an in-person nominal group technique that you can do. So given what you know now as a group, I have a question. In your opinion, what tools or technologies would be needed to effectively implement NGT in a virtual setting? And so when I say virtual setting, I mean like a focus group or multiple interviews, but it'll likely be a focus group. So you can put in the chat or you can unmute. And I really want to know, and it can be anything, there's no right or wrong answer, like what tools or technologies do you really think would be needed to be able to conduct an NGT in a virtual setting? Sorry.
I would encourage people to just speak out. Amber and I talked a little bit before that thank you for putting things into the chat, but you can just, shout out as you have these thoughts. So we can get to know you a little bit. Some of the things that have been mentioned are the virtual whiteboard, a reliable internet for sure. Meredith put that in. The whiteboard is a definite tool. How about breakout rooms? Is that something that would be needed?
Breakout rooms would not, and you'll see why when I give you an example. But the whiteboard, yes, you definitely need reliable internet service. Someone dedicated to monitoring online activities only, yes. Anything else? And you can think about the same things that you need to do a focus group online as well. Because remember, that discussion part is very qualitative. And you're leading the discussion, you're guiding people through answering the question. So the same thing you would technically need in like a virtual setting for a focus group or an interview is almost mimicked when doing NGT in the same setting.
Well, that being said, would you have a requirement for having 2 people to lead or moderate the discussion? I mean, I use the word lead very, very cautiously because really you're asking the group to really lead their discussion in a focus group or nominal group technique.
Yeah, that's a great question. And actually, let's move forward because I'm going to answer it in these next couple of slides. So adapting NGT in a virtual setting. There are some differences in person versus virtually, right? So you've already asked me the question about the group, about the facilitation demands. Technically in person, as well as the papers that I've seen and read, they usually have 2 or 3 facilitators. One person that's leading the discussion and kind of guiding people through the NGT process. Someone else that's taking notes on the side, helping to tally what those generation of ideas are, and maybe even creating that consolidated list of ideas across the group when it came to their rankings. And then you have a third person that's there just to provide support in any way that you see fit. While you only need one facilitator in a virtual setting, it is nice to have someone in the background that provides technical support, which is what I typically have, just because you don't have time to stop the discussion to deal with like internet connection, or if someone's unable to rank anything, if they're like using their phone or they're not, using their iPad and they're having issues, you want someone in the background that's able to then do a breakout room with that person, help them deal with those technical issues, and then bring them back without interrupting any of the processes that go on with the nominal group technique. So starting at the top, I wanted to just highlight a couple of differences between doing it in person and virtually. Obviously, in person, you're in physical proximity to the people that are there, but it can limit who can participate geographically, just like an in-person focus group or interview versus a virtual one. So again, virtually, you have more access to people geographically dispersed. So I'll talk about this in a little bit, but I did nominal group technique in online focus groups, and women were throughout Texas. So it was great. I was able to get multiple information from my research topic around Black women that lived in very different places in Texas, but it was still very relevant to my particular research question. And if you look through the literature, when you do an NGT in person, you can be done with a big group, but if we're talking about public health research, it's usually 6 to 12 individuals, which may seem like a lot, but in the virtual space, you do want to bring that down to about 3 to 7. Because again, you really have to monitor who's saying what, who's providing information, who may be talking a little too much, and you may want to get information from someone who maybe hasn't spoken that much throughout certain aspects of the maybe silent generation of ideas or even during the discussion phase. So you really want to keep that in mind as far as your group size. But again, this really this really is dependent on your specific research topic and what are the known to-dos for conducting research within your discipline. For logistics and accessibility, in-person requires a physical space, requires travel for participants most times, and then it uses physical resources, flip chart, whiteboard, in-person, things like that. But virtually, it does eliminate that physical space and travel requirements, but you do need a video conferencing platform like Zoom or Microsoft Teams, and you do need to have a document sharing platform. I use Google Sheets because my topic they weren't providing private information or anything like that, so it was okay to have them rank their items through Google Teams, and it's a good way because most people are familiar with it, everyone can get access to it, and then you can keep it for later, so you don't have to worry about how am I keeping this data. And it's so similar to Excel, so you can already input your equation to automatically provide you with the sum, so you have an updated rank in real time. And I'll show you about that in a little bit. So again, those facilitation demands in person, you need about 2 to 3 facilitators. Online, you really only need 1. And even for the group, it's always weird to have 2 people virtually trying to dictate or guide the discussion. So a lot of times, well, what I've done is I'll introduce the person at the beginning, and then I'll say, okay, well, they'll be in the background. If you need something, they're here, but you won't see them. And that's just to make sure that participants are comfortable knowing everyone that's within this virtual space for this focus group, and that they're not caught off guard or someone kind of pops in and pops out. Something that I didn't discuss that I just thought about is I didn't discuss time management. And that's something that's very important when we talk about NGT and the processes. So I would always say to kind of give yourself more time than you think you'll need, because you never know if you'll have technical issues, somebody doesn't have internet or anything like that. And I'll discuss that after I give you this next example. So for one of my studies, I did nominal group technique in a focus group. And my reason for doing that was because I did a pilot study where I was trying to identify key ways to increase PrEP use among Black women who are vulnerable to HIV. So something that I found was that in my own research and other researchers across the South, we all kept finding the same factors, the same barriers, and the same facilitators that were associated with uptake of this specific HIV prevention tool. And so I wanted to know, for intervention development purposes, okay, well, how are women prioritizing these barriers and facilitators if we're thinking about creating an intervention or a program, which is something that I hadn't really seen in the literature other than us just kind of saying what these barriers and facilitators are. So that's one of the reasons why I wanted to use NGT for like in a study format, because I didn't want to only know how they prioritize them. I wanted to know why they're prioritizing them and how that relates to individual characteristics of these individual women in those focus groups. And then two, I wanted to use a choice-based conjoint analysis. And I'll tell you what that is right now. So you have these things called stated preference methods. And it basically it includes various techniques to systematically identify individual preferences for a certain service or a product by its attributes. So let's say I'm looking for jackets for my basketball team, but I really care about the color of the jacket, if how warm you're going to be with the jacket, how long the jacket is, if there's a zipper, if there's a button. So choice-based conjoint analysis is one way where you can identify what particular parts of that jacket are preferred, and then you can create it. So for intervention development, choice-based conjoint analysis is one type of stated preference method. Basically, it helps you estimate the overall preference for a specific product. In my case, it would be PrEP, that HIV prevention tool. And then I also want to understand what aspects of that tool women are wanting to use if it was input in an intervention. One way to do that is to use nominal group technique to identify what those attributes are. So I use nominal group technique to do two things. Not only identify how women are prioritizing barriers and facilitators towards a specific HIV prevention tool, but I also wanted to use that to identify a follow-up study that used a different technique. NGT is a great way to do that, to not only provide you with a rank option, so if you want to do intervention development, but it provides so much data that can be used in very different areas of your own research. And these are just two examples of how I use nominal group technique to inform two different areas of my own research. So I use focus groups, online focus groups using Zoom to conduct NGT. And for the ranking options, I used Google Sheets, which is basically an Excel equivalent. Within Excel, I had certain equations included. So as women ranked the options, I was updated in real time what the overall group rank was for us to then discuss it during the final discussion phase of the study. So what were my nominal questions? I wanted to know two things. For women, what concerns me most when considering PrEP, which would identify those barriers? Then I also want to know what is more likely to make me consider using PrEP, which would identify those facilitators or those motivators for using PrEP. And so basically, I did this in a few ways. So for my NGT process, I reviewed those rankings, explained reasoning, and consolidated options. But what does that really mean in terms of nominal group technique? So in mine, I did 3 steps. I had an introduction, like we saw in one of those prior examples, where it was my step 1. I did a welcome and overview, and I provided information about PrEP. And I'll get into that in a second. 2, I had those ranking specified items. And then 3, I had a group discussion that included 5 specific questions that I asked across those 2 individual nominal questions. So for step 1, I didn't include as you can see, I didn't include a silent generation of ideas. Instead, I had a welcome, I did the overview, I provided women with what is PrEP, the efficacy, the effectiveness, how they could access it in the typical process women would use to access it. So you really need to make sure, one, that your population knows about the product or the items or the idea around the question that you're asking. And if not, you really need to provide that at the beginning of the session.
Amber, I have a question.
Yes.
I have a question. So you chose not to do that kind of silent generation, which really I'd like to understand better.
Yes.
Because I thought that one of the from Lynn's presentation a few months ago, and from what I read, having people independently generate thoughts about whatever the research question is, or whatever the research question is, kind of takes out the initial, at least in the initial steps, the potential for group dynamics, so that some people will not come forth with whatever they think. So I've always kind of appreciated that independent generation, list generation before a group discussion. So
Yes. So as I said earlier in the presentation, there were a lot of, let me take a step back, I'm sorry. The purpose of mine is to inform intervention development. So we already know about these barriers of facilitators towards my specific research topic, which is utilizing PrEP. And so I wanted to better understand, without them creating new barriers or new facilitators or anything else, what these overlapping factors that all these other studies have already found, how they would prioritize those. Because there were not, in the last, I want to say last 5 years, other than maybe medical mistrust and PrEP-related stigma, there hasn't been a lot of new findings regarding these barriers and facilitators. Now, in step 3, we do provide that option, which is, I know during the later in the discussion, for them to then add to that the initial list of items that were provided, take away, consolidate things, let me know if anything was hard to understand. But also remember, I'm using this NGT technique to also create attributes for our choice-based conjoint analysis. So if I was just trying to understand women's barriers and facilitators to using PrEP, I would have included the nominal, I would have included the silent generation of ideas because I would have needed it. But because I'm trying to do 2 things, and one of the main things is understanding what those attributes should be, then it kind of makes that particular step a little bit unnecessary for this particular study, because I'm creating attributes needed for another step. So it's not anything new. And then we're trying to understand modifiable barriers and motivational factors that are already present. And if they would have brought up like different barriers that we really can't control, then it kind of would defeat the purpose of the choice-based conjoint analysis and including those attributes. I can explain choice-based conjoint analysis a little bit later. CBC, I know that's a lot, and I know I haven't really gone into detail, but that's one of the reasons why we didn't do the silent generation of ideas for this particular study. Not that it wasn't necessary, it's just that based off the data that we already have, it's just really important to know, like, how are they listing it? And if at the bottom of each of those lists is like having childcare or maybe having social support in certain ways, maybe those things don't need to be prioritized in intervention development as much as maybe addressing cost or addressing access as far as like patient-provider communication. So just some things to think about. And there was another study by Nelson and colleagues that also used the literature, did a lit review like I did, in order to create their list of items by skipping that silent generation of ideas. So I wanted to also provide, at the bottom of my slides, there are resources available that just provide similar articles for what I did. And so I did follow Nelson and colleagues' steps in a way for how I conducted my study, really out of curiosity to see, well, do I think that new ideas would have come up? Of course. But would those ideas have been modifiable to include in the intervention? I don't know. And if they would have provided more ideas that aren't modifiable, now how does that affect my overall study when I needed, specific items? That was a great question. Thank you. So step 1, welcome overview, provided PrEP information. I skipped the silent generation of ideas, and I provided 2 lists of 16 options based on the literature. 16 options that were specific to barriers to using PrEP, 16 options that were specific to facilitators to using PrEP, most of which had overlap across multiple studies that looked at barriers and facilitators among Black cisgender women in the South. And so after that, after they ranked everything, I had a group discussion, and I asked specific questions, and I had to make sure that I considered that I didn't ask them to generate any ideas, but I wanted to give them the option to still adjust the items that we created because something new could have come up. So I asked the group, why do you think the group chose so-and-so as the top ranked item? Why do you think the group chose so-and-so as the bottom 3 ranked items? So we did that for the top 3 ranked items and the bottom 3 ranked items. Now, you can do this in any way that you want. You can just do the only top 5 items, only the top 10 items. Maybe you're more interested in why the items are lowest because you're trying to understand what aspects of your intervention or your program to maybe take away that you feel like may not be as necessary. You can focus on the lower items, but there's many different ways to do the group discussion. You just need to know, what is it that you really want to understand about these ranked items? Is it that you're having them rank aspects of an intervention that they liked or disliked. And so now you know, oh, the ones that were ranked low need to be updated, or maybe they don't fit logistically into a health system with regards to what you're doing. So make sure you're very specific with what you want to know. So I wanted to know why they ranked the top 3 and bottom 3. I wanted to know, were any items hard to understand or unclear? And across both focus groups, everyone was like, nope, everything was straightforward. I didn't have any questions about anything. And then I also asked them, are there any items that should be removed from the list that you feel like aren't relevant? And there weren't any, but some women, with regards to, are there any items that should be added to the list? Some women wanted things combined. Some women wanted things maybe worded a different way because they just liked the way it was worded. And so we'll get to that in a minute as well. So what does an NGT process typically look like in an online format? So let's say that I went ahead and I showed you a quick 5-minute PowerPoint. I introduced myself, I explained the purpose of the study and why you're here. I talked about prep and the process to get it and what it is and so forth. And then I walked you through the actual steps and what I want you to do for that NGT process. So I will send you a link through the Zoom chat. You click on it and you get taken to a Google Sheet. The Google Sheet would have your initials next to a sheet number. So that sheet number corresponds to the number that I wanted the participant to use at the bottom. So they clicked on the number. Let's say my initials are KW and I click on number 1. So now I'm going to see that first question. And it's, what concerns me most when considering prep, with those 16 items that I wanted them to rank? 1 being the most important and 16 being the least important. I wanted them to rank everything only once. And I let them know that if they ranked anything twice, it would show bold red. And that would let them know that they gave 2 items the same ranking and they would have to adjust their ranked items. Only one numbered rank per item. So then they would click on the drop down arrow and start ranking items 1 through 16. I made sure to explain, go in order. Don't go 1 and then 10 and then 2 and then 12, because you may get lost. And so I had them have time to just read the list, read the question, and then start to rank their items. As a facilitator, you see a screen similar to this in Google Sheets. As I said earlier, I already had the equations set in there. So as they're ranking on their individual sheets, you're seeing this overall group rank of items. The colors coordinate where dark green, the darker the green is, the higher the rank, the darker the red, the lower the rank. So again, remember I had them rank 1 being the most important, 16 being the least important. So for this particular focus group, let's say you only have people on sheet 2, and then 4 to 9. So that's why you see 1 and 3 being 0. Maybe someone didn't show up, which happens in focus groups. Maybe they had technical issues, and we'll get to that later. But you see this sum of the scores and the rank. So as participants, you would see something similar to this screen. And I would start asking them like, okay, we'll take a minute, and we see that number 1 was no health insurance, not enough coverage. We see that the number 2 across the whole group was prep side effects. We see prep is expensive was number 3, and I may do that for like the top 5 items, or maybe just the top 3 items. It just depends. And I'll also do that for the lowest items too. So I'll give them time to kind of see the list. And as you notice, I didn't reorder the items based off the rank, because one thing that they are already used to is seeing the list, the ordered list in this particular way when they rank them in their individual sheets. So I didn't want to confuse anyone by putting it in the correct order for them. I just left it the same, and I didn't have any issues with anyone kind of being confused about the items. Something I did do was I covered the other items when we were talking about item 1 or just item 2 or item 3. I blacked them out so they could only focus on that one thing. So again, I asked participants, why did you choose the top 3 items? Why did you choose the bottom 3 items? And I went item by item. I also asked, okay, well, looking at the full list, based on this question, are there anything that was unclear? Are there anything that you probably didn't know what it meant? Was anything confusing? And no one said anything was confusing. It was very clear. It was very straightforward. And then I asked them, should anything be removed? And they took a minute, they looked, it's like, no, this seems like everything. And I said, well, should anything be added? And then they really started kind of going in and maybe combining 2 things, or being like, oh, I think judged by my family and friends should be 1 item. But if you're very familiar with choice-based conjoint analysis, everything has to be very specific and mutually exclusive. So we took those factors into consideration as we kind of had them discuss options to add, remove, and so forth. So I'm going to discuss the top 5 items for example purposes. These are the top 5 items ranked across both focus groups. Notice that there's 13 here, and initially the people who were in the discussion was 14. So just keep that in mind. So the top 5 items were PrEP side effects, how PrEP might affect other medications I'm taking, no health insurance and not enough coverage, being judged by my doctor, PrEP is expensive. So when we asked them to further elaborate on like why these top 3 items were here, they also touched on other items that were ranked within the top, I'm going to say 5 to 8 items on the highest ranked items as well as the lowest ranked items. So for instance, we did a thematic analysis for the qualitative, for qualitative analyses from the discussion. And we found that PrEP side effects were there because people had concerns about uncertainty about side effects and interactions with other medications, which was pretty known from the list. Interestingly, for accessibility of PrEP, it was around cost, being able to afford PrEP in general, but then having health insurance to cover PrEP. And then also just feeling judged about for requesting or taking PrEP. So that PrEP-related stigma did also show up within our study. So after you do this, you kind of see a little bit of like the NGT process. I talked about how I came up with those listed items, what my NGT question was, what my nominal question was, how I guided them through those steps, how I explained for them to do NGT. I did an introduction. I skipped the silent generation of ideas for my study. I had them rank the items, and then we went into a discussion. I did not have them re-rank the items at the end of the discussion, though. I didn't feel it was necessary, and for time requirements, I didn't want to go to 2 or 2.5 hours. In my experience, people start kind of losing focus at around an hour and a half in focus groups and interviews. So I really tried to keep it strictly at an hour and a half or less. And so by taking out that re-ranking of items, it did save time. And that is a limitation to this particular study. Not having that silent generation of items is also a limitation, but because of my reasoning for doing it, not so much. And because I've seen other studies do it as well, it kind of provided a little bit of strength to not including that option.
Amber, I have another question.
Yes.
Well, you gave a good justification for your reason not to include the silent generation in the beginning. But I'm not really, I'd love to know your justification for beyond just it saves time, because it seems to me that during that discussion, there could be very substantial and important changes in the ranking of priorities. Some, you know, things may emerge in that discussion, that group discussion, that people were not aware of before, and that totally changes where they would be ranking things. So I'd like to understand more about what your rationale, your justification for getting rid of that second ranking step.
Yes. When I did my own research of the literature, a lot of people really aren't using that re-ranking option at the end. So I was like, I wonder why. And I did speak to a colleague who said it really depends on the discussion that you have in that first session. And it's like, you should be able to, I guess, add more sessions on as you go. So let's say you do an NGT and you're like, I only want to do 3 NGT sessions. The session 1 and how you conduct it, it's kind of like your baseline. And so when you do that second one, while the questions and the process needs to stay the same, how you do it can just be adjusted a little bit. So for mine, I did take that into consideration. I was like, well, let's see what they say in the first discussion. And if anything comes up where we will make them want to re-rank. But interestingly, in this particular study, and this is not representative of other studies, women didn't I guess say anything that alluded to the fact that they wanted to re-rank. Some of them, like, so from most of the group, as you can see, they listed like the top, let me go back one, top 5 items. This was true across both groups. So they were like, oh no, I listed side effects or no health insurance as my top 3, and here are the reasons why. But that was true across everybody in both focus groups. And they also agreed unanimously as a group around the items that was also chosen last. And so when I asked those additional questions about like, should anything be added? Should anything be removed? Again, the same thing, the same responses were given across both groups. And it could be really based off of the demographics of the women in this particular study. It was between 18 and 44. Most of them were in the South, so maybe certain items that are affecting women in the South versus other regions are very similar, which makes sense. But it's just something for me to think about as well. I think if I was to do this without the purpose of creating attributes for a choice-based conjoint analysis, I would use all 6 steps, including that silent generation of ideas, and I would do a national. I would include Black women nationally in those NGT sessions to see what would come up. Let me move forward, sorry. So that does bring me to things to consider when conducting the NGT session. One, within any qualitative research, whether it's focus groups, interviews, there's always going to be maybe an imposter participant that comes in, and that is something that happened in one of my focus groups. So you kind of want to make sure you're very up to date with like the best methods on conducting online focus groups in general, just so you have a good plan, a good plan when you just conduct any type of research to deal with like fraud. So you have like a fraud prevention protocol in place, which I did. So if anyone came into my study that wasn't supposed to be there, that didn't consent or wasn't eligible, I can just remove them. So I put them in a breakout session room, let them know, sorry, you can't participate. I don't have a consent form for you. You didn't go through the eligibility procedures and so forth. So that is something that can happen in a virtual NGT session when people just kind of show up and you don't know how they got the link or why they're there. So just something to consider. Some participants are not familiar with different types of online formats. Some participants may not be familiar with Google Sheets. They may have issues just like staying logged into Zoom. It may be dependent on age. It may be dependent on just their tech savviness. So having that important first step of really describing what you want them to do and showing them what you want to do is important. And then having a tech person or someone, an assistant or someone there like in the space that maybe they can't see, but they know is there to help you with tech support is also pretty important. So again, having that other person there you would need to do. And then maybe even doing a run through, like having like a mock focus group is very important as well. That would also tell you if you need to do that generation of ideas, that would be better, or to do a generation of ideas and add it to a list that you've already created. Like there's different ways to do that part. And that would also tell you if you want to allow participants to be able to re-rank their options after that group discussion at the end. So I told you some things that I did and some things that you may need to consider when doing it, but do you think there's any other factors that should be considered when conducting NGT in a virtual space? I'm sorry, everybody.
While people are thinking, and I really encourage people just to shout out their thoughts. One of the thoughts for me is, since it's virtual, what are your thoughts about some people preferring not to show their face and others preferring to show their face?
I am okay with that. I asked everyone in my initial consent form, consent in 3 different ways. One, if they want to participate. One, if they're okay with being audio recorded. One, if they're okay with being audio and video recorded. So before we even start the recording process, I do say, okay, anyone that didn't provide consent to provide to be video recorded, please go ahead and disable your camera now. Luckily, I'm kind of used to doing it online. I mean, doing focus groups and interviews online. So I'm used to seeing that little light up part come up when they're talking. And I kind of have a little bit more control over muting and unmuting. So, and I tell people, I try not to allow people to also use the chat too much. So if they're not using their screen, like their video, I say, okay, you can't use the chat. You're going to have to really make sure you speak up within this session so we can make sure that we're making sure everyone's being able to be heard. But I'm okay with them not using the video in the NGT session because it's needed, but not really. And it depends on the number of people. If you have 4 to 6 people in that focus group, you can easily see who's talking and everything. One tool that I use is when I'm providing feedback or talking to someone, I always mention their nickname or their initials. So for transcription purposes specifically, so that way we know who's talking. And so it's always like, okay, thank you, KW, for your comment. Does anyone else have anything to add? So you have to kind of get used to doing that if people aren't using their camera. You have to always mention their first name or their nickname, or I don't know if people use like an ID number, like, well, whatever you're going to have them display as their name on the screen. You need to get used to saying it, because if they choose not to show their video, you're not going to know who's talking, especially in the transcripts, if you're not consistently like calling that person's name or saying, okay, well, thank you so-and-so for your comment. Thank you so-and-so for your feedback. And then keep doing that throughout the process. So I'm okay with it. I have not had a time where someone hasn't been okay showing their face on camera for the focus group. And neither one of these, everyone was okay with showing their face. It may be because the questions weren't sensitive and I wasn't asking about sexual health. I wasn't asking about IPV. It was just asking about their opinion about certain items. And so people probably felt way more comfortable just having that discussion. But again, it really depends on the specific focus. If the more sensitive your research topic or even your nominal question is, you're going to really have to consider how you want people to interact with you virtually. So I know I answered your question, but for everyone else, it really just depends on that.
Yeah, no, I think, thank you, Amber. I think that it does depend a lot on your decisions depend a lot on what is your question, your research question. And the sensitivity or lack thereof certainly enters into it. My one concern is if some people are, not showing their face and others are showing their face, you have a disparity in what what input people are receiving from the discussion. And, it doesn't take away from the fact that, yeah, if everybody showed their faces, not everybody necessarily will be taking in what might be shown on those faces, but it does create a disparity that kind of, to me, would potentially speak to a limitation that needs to be noted, as there's a difference in the discussion based on whether I show my face or I choose not to show my face. So that's the one thing.
No, I agree. Participants don't realize that either. So they're not thinking in terms of like the researcher or facilitator. A tool that I've found useful is I make a list of everyone that's supposed to show up in the focus group. And then I have like the question order like at the top in columns. And I'm Xing out or checking who's speaking during each one, because you really do want feedback from everyone, but you don't know if someone's not speaking because they're doing something. You don't know if they feel like there's this power imbalance there. So maybe someone knows more, or and they feel like, oh, I can't speak. This person knows so much. I try to make it so it's very inclusive, like, oh, well, so-and-so, well, what do you think? Or, oh, okay, thank you so much for your feedback, KW. You've given us so much information. Wow, thank you. So-and-so, did you want to add anything? So I'm always trying to make sure I'm kind of like, not picking on people, but providing that space for people who maybe aren't speaking up as much to be able to speak up. And now, and for them specifically, I will ask probing questions like, okay, well, you said you like the color orange. Like, could you elaborate on that a bit? And that kind of gives them more confidence to be like, oh, my voice matters in this space. And that's regardless if their face was shown or not, because there's always going to be this power imbalance, whether you do a qualitative study in person or if you do it virtually, specifically with regards to focus groups. And that's that is a limitation of just the virtual space in general. When you conduct qualitative research, you got to figure out like what tools work best for you with leading that discussion, because those ranked items for NGT are the ranked items. The most important part to me and the meat really does come from that qualitative inquiry piece. So you really got to use your focus group tools to really start probing and trying to really understand why they ranked it that way, and not only how it applies to them specifically, but just like the overall group. Like, well, why do you think that? An example would be most across both groups, everyone listed needing childcare last. Everyone, it was unanimous. And so I was like, well, why did you do that? Like, why is it last? The two women that had kids were like, I have social support. I don't need that in a research program. I don't need that in a program. Like, I have people to help me watch my kids. And people who didn't have kids were like, well, I don't have kids, but I also have support systems. So it was like, okay, great. Social support may be very important when it comes to women who have or don't have kids, other than that particular aspect. So when we start really trying to get into like the meat of why they rank these things, having those probing questions are important. But then again, making sure you're allowing people who aren't speaking the space to speak really does help just illuminate the qualitative process in this particular environment. But again, like you said, Lauretta, you do have to very much consider those limitations in conducting qualitative research in an online space anyway. Like, regardless of what technique you use when you're conducting a focus group, you're still going to have limitations that you need to plan for. So I had a fraud detection protocol in place in case the participants came in. I had a technical protocol in place in case someone had internet access issues, and like what I could do if my person that provided technical support had internet issues would happen, what I could possibly do. And unfortunately, in one of my focus groups, someone wasn't able to rank their options. So then what do you do with that? You know, do you allow them to still participate in the overall discussion? Do you remove any other information from the transcript because they weren't able to rank anything? Do you still give them the incentive at the end? So these are some things you really have to consider when you're doing anything in just a virtual space in general.
Yeah.
In the chat, someone did ask, agree with time being a factor. It's hard to keep up energy and interest in long online meetings. True. Do you build in breaks or have other ideas for keeping up energy? Because of the time commitment, so for my particular study, I did 2 nominal questions within a 90-minute process, which is a lot to me for a 90-minute process. Technically, if I was to do all 6 of those steps, I would only get through one question, like either the question about facilitators or the one about barriers. Not having that last step helped me, but I think I would have been able to get through it anyway. It's just about keeping people structured in what they're doing and being very strict with the time. But I didn't provide any breaks. For either focus group, everyone seemed to be pretty engaged. The ranking process alone makes you engaged. Discussing those rankings alone like keeps you engaged, because then you're hearing what other people, like some people were like, oh, I ranked that as number 2, but it's probably number 1 because of this, this, and this. So now you have people being like, oh, I ranked mine number 3, but I see that, you know, this is number 1. I can see how it could be number 1 because of this, but number 3 is important too, and here's why. So I don't think across both focus groups, it wasn't any issue with like keeping up the energy, because they were excited to see like the rankings across the group and what everybody as a group like ranked as number 1 through 16. But again, that could be because of the participants I had, because of their age group, because of the time that I had them conduct a focus group, which was in May towards the end of the year. You know, if they had kids, they may have been in school. Like, so you kind of also need to keep into consideration what's going on. Like, I would never do a focus group around Thanksgiving or Christmas. It's too much going on. It's holidays. People are busy. They may not be as engaged. So you want to be also kind of mindful of that. But I think, again, that's with any type of online focus group or like virtual interviews that you do. You want to keep in mind what's going on in the real world. I wouldn't do it around election time. Like, these are the things that I just kind of consider. But yeah, I didn't build any breaks. I think if it was a 2-hour focus group, I would have needed to provide a break, because that's just a lot. But again, they're doing things throughout. Like, they may be watching you the first 10 minutes, but they're interacting by ranking these options themselves. They're interacting by engaging in the discussion, and you kind of calling people to kind of contribute. And so, I mean, I didn't have any issues with that. I don't really have any ideas for keeping up energy other than making sure you keep that list and like making sure you're giving everybody space to contribute to the conversation throughout the entire conversation. Because you don't want to look up and one person's giving you all this feedback and then two people have said yes and no throughout the entire discussion. So you don't really have them contributing. So it's kind of like, oh, you want to just make sure people are, like I said, talking throughout the discussion, providing feedback and so forth. Sorry, that was a long-winded question. I answered to your question.
Well, thank you. We're getting to the top of the hour, and I want to be respectful of everybody's time. Do you have any, it was a great and very informative presentation. I thank you for that, Amber. Do you have any concluding remarks that you'd like to share with the group?
No, well, keep two things in mind. Keep in mind what the literature says about what your target population already knows about the topic, service, or product that you're wanting to have them create ideas for around your particular like nominal question. And then keep in mind the percentage of the population that's already using it, using your product or service or familiar with that topic as well. It really will kind of help you better to identify what the nominal question needs to be, how you want the people to engage within the process. And it'll let you know if you want them to be able to re-rank that process, if you need to have that generation of ideas at the beginning versus like using the literature to identify those items that you want them to rank. And it depends on your focus. Are you doing intervention development? Are you trying to just add to public health literature? Are you trying to identify a gap? So keep those in mind as you go through the process. And it's just a great way to marry quantitative and qualitative research to provide good findings. Yeah.
Thank you so much. And unfortunately, I can't tell anybody about next month's presentation because that information hasn't been loaded onto my new computer. So I'm as dumb about this as anybody else. But we will be sending out a monthly reminder at the beginning of next month. And I look forward to seeing you all. Have a wonderful weekend and a very happy Thanksgiving.
Bye, everybody.